New Zealand charity, the Fred Hollows Foundation, is working to improve the level of eye care in Papua New Guinea, which has the highest rate of blindness in the Pacific. The country struggles to provide health services to the 12 million people who live there, many in remote communities. Pacific correspondent Barbara Drever with this report.
Madang Hospital is not for the faint-hearted. It's too hot for mum Petronella Robert and her sick toddler in the ward, so this is where they sit to catch the breeze. Parents travel from remote communities on foot and by boat to get urgent treatment for their children.
This is the only hospital for the Madang province, and that means it's the only hospital for around 600,000 people. And it's a province that stretches over nearly 29,000 square kilometres, so it's difficult to access for many.
Resources are stretched. Not everyone gets diagnosed and treated.
Sometimes we put our budget through the government, national government, and national government does not give us the full request amount. So they cut it down, so we have to revise the budgets.
Chair of the Global Fund and wife of late Prime Minister Sir Mekere Morauta, Lady Roslyn, says PNG has the third worst health coverage in the world, only ahead of Chad and Somalia.
I mean, that's an extraordinary statistic for a country that actually has a lot of mineral, natural resource wealth. But the government isn't translating that wealth into real services for people. Without organisations like Fred Hollows, with its niche interest in eye care, that service would not be provided at all.
Nearly 6% of all people over the age of 50 here are blind, making what the Fred Hollows Foundation does so important. They're empowering the local workforce. They've trained more than 100 specialist eye nurses, and the foundation's about to build an eye clinic attached to the hospital in the capital, Port Moresby.
The type of work that we have embarked on, which primarily is about supporting government partners, government ministries, to build eye care systems. We feel like the next step for us is to help them really start to support them to shape their systems.
Not just restoring eyesight, but boosting an ailing health system to make a real difference. Barbara Drever, One News.